everyone, and welcome to another edition of For the Health of It. I'm Lou Beccaria, and thanks very much for tuning in. We really appreciate it. Our show today is about something that's extremely important to all of us, and that's eye care. And with us to talk about this very important area is Dr. Ravi Patel, who is with the Moore Eye Institute here in the Phoenixville area. And he is a cornea, cataract, and reflective eye surgeon. So welcome to the show. Great to have you here, and thanks for taking time out from your practice, Doctor.
Thank you, Lou, for having us. Well, we can share a little bit more about eye disease with the community here.
Yeah. So first, before we get into that, tell us a little bit about your own background. How did you get into eye care?
So, it's interesting how people sort of pick a medical specialty. I was fortunate enough to find a mentor that I'd identified when I was in medical school. And it's actually an ophthalmologist locally in Delaware that I really enjoyed seeing his patients, seeing his practice, and just sort of the combination that you could take care of patients in such a way where they get instant gratification from things we do with surgery and yet form long-standing relationships with them. So I went to medical school at Jefferson, and then I did my residency training at the University of Pittsburgh, and then I went on to Miami at Bascom Palmer Eye Institute, where I did a fellowship in cornea and refractive surgery.
I see. Are you originally from this greater Philadelphia area?
I am. We had relocated to Delaware in the mid to late 1990s, and so I always saw myself as coming back here, even out of the Florida sun.
Okay, good. Well, let's start off with talking about refractive surgery. Somewhat of a tongue twister, but what is refractive surgery?
That's a great question. Patients come and ask us that all the time. Refractive surgery is any sort of eye surgery that decreases your dependence on wearing eyeglasses.
Oh, okay.
So for somebody young in their 20s or something, it could be something like laser vision correction, like LASIK or PRK. People that are a little bit older, we now have refractive cataract surgery, since we're now able to do cataract surgery and decrease our patients' dependence on eyeglasses.
Okay.
So even in that spectrum, there's so many different choices that we now can offer patients that we didn't even have 5 years ago.
Can you explain to us about LASIK surgery? That's a relatively new term to the average layperson, I guess.
Sure.
So what does LASIK mean?
Sure. So LASIK is an acronym which stands for Laser Assisted In Situ Keratomileusis.
Wow.
Big tongue twister for you there, but we won't. There's no test at the end of this, I hope. But LASIK itself is a laser refractive surgery where we take a cornea and reshape it using a laser. The cornea is the clear surface to the eye that you can touch. It's actually in the front of the colored part of the eye. It was FDA approved in the early to mid 1990s for treating people with nearsightedness and farsightedness. And later into the 2000s, we moved away from doing LASIK with a blade to now all laser LASIK, which is state-of-the-art LASIK that we offer to all of our patients here at the Moore Eye Institute.
LASIK with a blade sounds very brutal. Thank God for the new version.
That's exactly right. We get better outcomes when we can use a laser. Any steps that you can take away from human error and put in the hands of a laser, our patients see better and do better.
Yeah.
So we're able to treat higher levels of nearsightedness and farsightedness, and our patients do quite well and are very happy with it.
Yeah. Let me ask you about the term nearsightedness and farsightedness, because I've been confused about that, and I guess some of our listeners and viewers might be too. Nearsighted means you can only see close, or does it mean the opposite? You can't see close?
I think you're spot on. Nearsightedness means that you can see up close without needing to wear eyeglasses. Okay. And what many patients do is they lift up their eyeglasses and are able to see. That tends to be from nearsightedness. Okay. Farsightedness is a little bit more complicated and confusing. It actually means that you're able to see far away but not near. And truthfully speaking, when patients are in their childhood years and teenage years, they can see far away, they can read, they can use the computer and do a little bit of everything. And then the late 30s come on, early 40s, and they can't see the computer as well anymore. And then a little bit of time goes on and they can't read as well anymore. And then a little bit more time goes on and they're in their mid-50s and they can't even see far away anymore. Their eye has lost the ability to what we call accommodate, or focus when they're previously farsighted.
Yeah. What causes all those changes that you were just talking about, Dr. Patel? I mean, the other parts of our body age, obviously, so obviously our eyes age too, but what causes it in the eye?
What happens inside of the eye is that most patients start developing a cataract. And a cataract is a clouding of the natural lens inside of the eye. When we're born, all of the proteins and crystals inside of the lens are usually crystal clear. As we have birthdays in light, our eyes are exposed to sunlight, UV light, smoking, etc., and other poor and unhealthy lifestyle choices. The proteins denature and they become cloudy, so you don't see as well through them. Before the actual clouding happens, the lens starts to stiffen up. And it doesn't let the lens, which is the natural lens inside of the eye, change in shape from almost a flying saucer to a spherical globe-shaped. That's what a young child's lens can do, but as we get a little bit older, it sort of gets stuck and rigid in its ways, much like many patients stuck in their ways.
Well, it sounds like the eye is a very complicated mechanism, the way you're explaining it. Is it as complicated from a surgeon standpoint as it appears from a layperson's?
I think it can be. In fact, we have so many different subspecialists, even in our practice, to deal with different parts of the eyes. There's somewhere between 10 to 12 specialties just dealing with the eyes.
Wow.
And so we all sort of subspecialize in our component of what we can help patients treat.
Now, earlier you were talking about, the cataracts and the ability now to do cataract surgery. What did people do before there was such a thing as cataract surgery?
So cataract actually comes from a Greek word, cataract, which means waterfall. And what the ancient Greeks and the ancient Egyptians noted is when you looked at somebody's eyes inside of the pupil, rather than it being clear or black, it started turning white, much like a waterfall. And that's actually the origins of cataract surgery in a procedure called couching. And over the past few millennia, we've really advanced it, and more particularly in the past 20 to 30 years, it's come a long ways where we're now doing, as I mentioned, refractive cataract surgery, and even doing lifestyle-based cataract surgery, where we have patients that come in and say, look, I can't see my golf ball anymore, I can't see to drive, I can't read the newspaper, I don't see the ticker on CNN or on CNBC. These are complaints that are now, with the baby boomers sort of getting into their prime years, we're hearing more and more at an earlier age.
Yeah.
And we don't have to wait for the white cataract or the waterfall to be in the eye before we do surgery.
I've heard the eye specialists referring to cataracts not being ripe enough yet. Why do they refer to it like that?
So a cataract is just a various stage of clouding of the lens, if you will. So they go from really clear when we're born to really cloudy, or like the waterfall as the ancient Greeks noted. Then there's a spectrum in between. I often tell patients that doing cataract surgery and getting the best outcome is like Goldilocks picking the right bed. Some are too soft, some are too hard, and some are just right. And to get the best outcome, you want to pick the ones that are just right. If you do cataracts that are too soft or not ripe, if you will, you're not going to get an outcome that's as good as if you do it when it's just right.
I see. Are there a limited amount of times that someone could actually have cataract surgery? Or is it a one and done kind of thing? You get it done once and you don't have to have it ever done again?
That's actually very accurate. You only get it done once. Cataract surgery involves removing the cloudy lens from the inside of the eye and replacing it with an artificial lens. Once that lens is removed from the eye, it doesn't regenerate, it doesn't grow back, and so it's a one and done sort of thing.
Okay. And does it tend to occur only in older people, say in their 70s and 80s, or could it be even younger than that?
Yeah, interestingly, the average age of cataract surgery in the U.S. is now in the late 60s. It's 69 is the average age where we're doing cataract surgery. So much younger than you thought, I presume.
Yeah.
The even younger patients, you can be born with a cataract. There are certain infectious problems that can happen that can cause cataracts at an earlier age. There are inflammatory problems, like patients that are on steroids for asthma, rheumatoid arthritis can get them at an earlier age. And now we're actually seeing them much earlier in our diabetic patients.
One of the questions I'd like to ask you is about, there's a term called astigmatism, and it's a pretty fancy word. What does it mean?
Astigmatism. Many people know they have astigmatism, but most people don't really know what it is. So the astigmatism comes from the fact that the shape of the eye isn't perfectly spherical. So if you imagine the cornea, which is the clear surface in the front of the eye, in many patients it's shaped like a basketball, round and smooth, even in every direction. When you have astigmatism, it means that the cornea or some parts of the eye are shaped more like a football than a basketball, where you have one long curvature and one short curvature. So you can treat this with using glasses or contact lenses, where if your eye is shaped like a football this way, you can wear a contact lens or an eyeglass shaped like a football this way, and the two together make a basketball.
Make a basketball.
That's exactly
Evens it
right.
out.
And we can now treat astigmatism with cataract surgery, as we now have lenses that we can put inside of the eye to treat astigmatism.
Yeah. Why is it that when someone loses their eyesight and goes blind, that you cannot see again? You cannot regenerate the eye? What is it about the makeup of the eye that causes that situation?
The reason that people lose vision is very complex and complicated. It really depends on why the vision's lost. If it's lost from a cataract or from the cornea, we can usually do surgery or offer even like a corneal transplant to rehabilitate vision. And this is why some people might have seen in the news that where I had trained at Bascom Palmer, they had repurposed a tooth, a patient's own tooth, and created an artificial cornea, and now she's seeing 20/20.
Wow.
Other diseases like diabetic retinopathy, macular degeneration, or glaucoma are much more challenging. And if you go blind from glaucoma, that's unfortunately not reversible. And the reason for that is the optic nerve, which is the cable that connects the eye from the brain, is damaged in glaucoma. And when that gets damaged, we really can't regenerate it because it's sort of like a part of the brain dying or having a stroke, if you will.
I see. Kind of like the heart too. When part of the muscle of the heart dies, it doesn't come back.
That's exactly right. A great analogy to having a heart attack and it not coming back. But with the eye, it's a little bit more subtle. It happens much, much, much slower.
What are some of the major causes of glaucoma that cause this situation?
We really don't understand glaucoma as well as we'd like to think we do. Truthfully, there are risk factors for glaucoma, but we don't have a direct cause. Having high pressure is one of the biggest risk factors for glaucoma. Having a few more birthdays in life than your colleagues is another risk factor. Being of certain descent, like African American and Hispanic descent, we tend to see more glaucoma in. And then there are other diseases in the eye, like diabetes, that's associated with glaucoma. So it's a whole consortium of diseases that damage the optic nerve that we label as glaucoma.
Going back to macular degeneration for a second, I've heard it described that it's like looking at a TV but with the screen narrowed, and the peripheral vision is no longer there. Is that correct?
I think that it's a little bit the opposite. That's very accurate for glaucoma. When you have glaucoma, you've seen the photos of where glaucoma blinds and Awareness Month during February, of where you can see right in the middle, but everything around the middle is blacked out and blinded, and that's from advanced glaucoma. Diabetic retinopathy tends to cause blurring of the vision because it can cause swelling in the retina or complete obscuration of the vision because it causes bleeding inside of the eye. Many patients have had their blood drawn, and as red as that is, you can't really see through it. So if you imagine if the eye gets filled with blood because of diabetic bleeding, you can't really see through it.
I see. Wow. My guest is Dr. Ravi Patel, and we're talking about issues related to the eye, diseases of the eye. I've heard it said that obesity and smoking and exposure, excessive steroids can lead to eye disease. Now, what is it about those three things that lead to eye disease?
I think all three of them have one thing in common, is that they tend to generate free radicals, or these sort of molecules in the eye or even in the body that cause inflammation. Smoking is particularly linked to macular degeneration and progression of macular degeneration. We know that in patients who smoke, that's the only, we'll say modifiable is probably the best word, the only modifiable risk factor for macular degeneration. The other things you mentioned of obesity and using steroids, steroids is a medication-related problem, which is a little bit separate. When you use steroids, it can raise your blood sugar, it can raise your blood pressure, and it can cause cataracts and even glaucoma inside of the eye. But with regards to diet, when our diet isn't very healthy, which means it's not rich in green leafy vegetables, the essential carotenoids, omega-3 fatty acids, we tend to build up more of these inflammatory molecules inside of the body and in the eye, which cause various degenerations and problems.
Wow. Okay, we're going to take a break right now, pay the bills. And so please stay with us. When we come back, we'll hear more from Dr. Patel on EyeCare.
Thank you.
At Phoenixville Hospital, we understand that life is too short to spend hours in an ER waiting room. And we know that in an emergency, minutes really do matter. And so, our entire team is committed to working diligently to have you initially seen by a clinical professional in 30 minutes or less. Because at Phoenixville Hospital, we think you should spend less time waiting and more time getting better. The 30 minutes or less ER service pledge, right here at Phoenixville Hospital.
Hi, welcome back to For the Health of It. I'm Lou Beccaria. For those of you who are just tuning in, we have the pleasure today of talking with Dr. Ravi Patel, who is a eye surgeon here connected with the Moore Eye Institute at Phoenixville Hospital here. So Dr. Patel, first let's start off with a little commercial announcement for the Moore Eye Institute. Tell us about the Institute and how it came to be located here at the hospital.
Sure. So the Moore Eye Institute was founded in the mid-1990s by our chairman and Dr. Leonard Ginsberg, who is actually the chairman of ophthalmology here at Phoenixville Hospital. After we had sort of gotten ourselves established in Delaware County, Dr. Ginsberg was approached by the hospital to sort of starting the Moore Eye Institute here at Phoenixville Hospital. And so about 2.5 years ago, that dream came to fruition when he and the chairman, Steve Tallman, had met and reviewed the logistics and plans. And 2.5 years later, here we are.
Good. And does the Moore Eye Institute specialize in any particular kind of eye care?
We do. We're a multi-specialty sort of service with regards to eye care. Most of our patients are coming to us for disease treatment. And so by that virtue, we're a disease center. We do see patients we don't see very many patients for routine eye exams, annual checkups, if you will. Most of our patients tend to be referred in for various diseases like diabetes or cataracts or glaucoma. And so we have specialists that have specialized in all of those areas.
Okay. One of the things, referring back to our previous conversation about macular degeneration, we didn't really talk a whole lot about the treatment of it. Can you tell us about that?
Sure. Macular degeneration, there's two flavors of macular degeneration. There's dry and there's wet. The dry is the most common type, which affects 90% of patients who have macular degeneration. So about 11 million people, if you will, in the United States are affected by this disease.
Wow.
The treatment for this is based on the National Eye Institute studies called the ARID studies, which stand for the Age-Related Eye Disease Study. The most recent update just actually happened earlier this year, so it's sort of hot off the press. We found that a particular combination of vitamins and minerals, which are vitamins A, C, E, zinc, and copper, if you can put those together and take them as a supplement, it decreases the progression of dry macular degeneration. And so this has been recommended by retina specialists and eye doctors for many years. Earlier this year, they've actually supplemented this study to find that adding omega-3 fatty acids, lutein and zeaxanthin, which are essential carotenoids found in green leafy vegetables, and also removing some of the beta-carotene, which was in the original formulation, even has a higher impact on the rate of macular degeneration progression. So this has sort of been groundbreaking news that nutrition plays such a critical role in the progression of macular degeneration.
Yeah.
With regards to the wet type of macular, about 10 years ago, there really wasn't a good treatment for wet macular. We tried lasers and surgeries and all sorts of things, but it really wasn't that successful.
What are the characteristics of wet macular degeneration?
So wet macular is labeled wet because it involves bleeding or leakage of fluid from blood vessels inside of the eye.
Okay.
Most macular degeneration starts off as dry, and then at some point in sensitive patients, it converts to the wet type of macular degeneration. That's a sentinel event that we want patients to pick up on. So another part of the treatment of dry macular is we give patients these checkerboard grids to look at. It's called an Amsler grid. It literally is just a small checkerboard grid, and we ask patients to self-test in the morning when they wake up or in the evening when they go to bed. And they're to look at this checkerboard grid and to make sure that there's no spots of the grid that are missing or blotchy and no lines that are wavy, that all the lines are completely vertical and completely horizontal. This is to catch wet macular degeneration. our body, in response to any sort of degeneration, will grow blood vessels to try to repair it.
Okay.
Unfortunately, these blood vessels are more fragile and not really strong, so they can break and bleed, and they're incompetent, so they'll leak fluid inside of the retina.
Okay.
So we now have therapies of injecting medication inside of the retina or inside of the eye directly to dry up or regress these dangerous blood vessels that have been formed inside of the eye.
Now, before you do that, I
Sure.
mean, do you numb the eye in some way? Because it sounds very painful.
Oh, that's a great question. That's probably the biggest fear of getting treatment for wet macular degeneration.
Yeah.
We have lots of diagnostic testing that we need to do first that involve a dye test where we inject a vegetable dye into the vein to take photos of it to find these abnormal blood vessels.
Mm-hmm.
We can take light-based laser photos of the eye to see exactly where those leaky blood vessels are. The treatment itself is actually much simpler than it sounds. It takes probably about 10 to 20 minutes in the office to do. The first thing is your eye gets extremely numb with a cocktail of numbing drops and numbing gels and potions and lotions, if you will, of numbing medication. We then sterilize the eye with a betadine solution, which is cold and wet, to sort of make sure that there's no infection or bacteria on the surface of your eye.
Okay.
Fortunately, you don't see the needle coming towards you. We ask you to look into a different direction, and it really does sound a lot worse than it is. Most patients will tell you that they feel a little bit of pressure at the time of the injection, but by the time they've made it home, they're completely unaware that anything has happened to their eye.
Wow. Okay. Now, one thing I've been dying to ask you is about color blindness. Okay, what is color blindness? Why does it occur? And is it something that's hereditary?
So there's two types of color blindness. One is hereditary or congenital, and that's what affects about 8% of boys in the country. It's called red-green color blindness.
Boys more than girls?
Boys, that's exactly
That's
right.
interesting.
It's actually genetically linked to the X chromosome, and so girls have 2 X chromosomes, so fortunately they tend not to be colorblind.
Okay.
And boys who only get 1 X chromosome, there's a higher rate of them being colorblind. And so it's about 8% in the US. And that's a congenital type of red-green color blindness. Often this is why women like picking out clothes for their husbands, because they can't match their socks to their pants or their shirts and their ties, and that's why they have wives to do it for them. But there's a acquired form of color blindness as well. Patients that have certain optic nerve diseases like optic neuritis, which can be a sign of multiple sclerosis, other problems inside of the optic nerve like a meningioma, which is a swelling on the side of the optic nerve. Anything that compromises the optic nerve can cause decreased contrast or color vision, if you will.
I see.
And so those are more dangerous findings. So anybody that's noticed an acute loss of color vision should seek emergency care to be evaluated.
Now, in color blindness, is it that people just see black and white? Or can there be a situation where instead of seeing something that's blue, they'll see it purple or they'll see it green? And later, can it change to that thing that's really blue? They now see it as red. Does that happen?
So I don't think there's much shifting that happens in terms of color vision loss. Once you're colorblind, the way that you perceive the color is the way that you'll always perceive the color.
All right.
In terms of red-green color blindness, which is the most common, patients confuse anything in those spectrums. So it's hard to see colors like purple and blue, which are combinations of colors, and they'll sort of see them in shades of brown, is sort of what patients have described to me. They know that your sweater is blue and that my tie is pink because from the day that they were born, when somebody holds up your sweater, Mom has said this is blue, and so little Johnny memorizes this color is blue. So acquired color blindness is a little bit different. That's a lot harder, where patients will literally not know what color it is because they've never seen it before.
Now, in either the hereditary or the acquired, is it reversible? Can somebody, say, be born with color blindness and then all of a sudden they don't have it?
Yeah, there's a lot of work being done for congenital forms of color blindness that are linked with retinal diseases. There are patients that are born without any pigment inside of their eye in a disease called albinism, and they also have difficulty with color and color perception. There really isn't much that we can do for congenital color blindness, but when you've acquired color blindness from something like optic neuritis, as the swelling around the optic nerve goes away, the color vision should return.
I see. Let's shift gears for a little
Sure.
bit. Earlier in the show, you were talking about the subspecialties.
Yes.
About 10 of them, I think you said. Could you tell us what some of those subspecialties are?
Sure. You know, my specialty is cornea, cataract, and refractive surgery, and so refractive surgery and corneal surgery is one of those specialties. Glaucoma, or glaucoma specialists who deal with glaucoma. There are retina specialists, that some can be medical retina specialists that take care of problems like tumors inside of the eye, diabetes, and macular degeneration. There are surgical retinal specialists who deal with problems like retinal detachments and bleeding inside of the eye. There are neuro-ophthalmologists who sort of interlay between neurology and ophthalmology. So diseases that affect the optic nerves, like having strokes or a multiple sclerosis. There are pediatric ophthalmologists that specialize in children and disorders of eye muscles and eye muscle movements. There are eye plastic surgeons that sort of take care of any sort of problems that happen with the eyelids or with the orbits, including things like droopy eyelids or tumors that can happen behind the eye. There are people that devote their careers to eye trauma and are traumatologists. And then there are uveitis specialists or doctors that specialize in inflammation inside of the eye.
Wow.
And that's just to name a few. There's probably a few more that I'm missing at this point in time.
Had no idea it was that kind of specialties. How about staring at the sun? You know, people say don't stare at the sun, it's bad for your eyes. Why is that?
Yeah. The eye is pretty much a camera, much like the ones that are being used today. There's two lenses in the eye, the cornea and the lens, and then there's the film or the retina. When you do direct sun gazing or looking right at the sun, it's possible that some of those sun rays are so strong and so powerful that they can proverbially burn a hole in the retina.
Wow.
They don't really burn a hole, but they really damage the photoreceptors, which are the intricate cells responsible for vision in the retina. And then patients don't see well, and you can get a big spot in the middle of your vision from sun gazing.
Amazing. Diabetes, let's go back to that. What is it about diabetes that is so destructive to the eye, causing blindness?
Yeah, diabetes is a very, very unfortunate disease. It is the leading cause of blindness in working-aged Americans. And what happens inside of the eye is much what happens elsewhere in the body. The eyes actually mirror the kidneys. And what we see in diabetes is not enough oxygen gets into the eyes for some sorts of reasons. We don't really know why. Blood vessels are incompetent. The glucose can deposit in the retina. And we notice that new blood vessels grow in response to lack of oxygen, if you will. They grow in response to high sugar inside of the eye. And patients get swelling in the retina and they get bleeding from diabetic retinopathy. And unfortunately, it's not until they have vision symptoms in diabetes that patients come to seek treatment from us. And by that point, the cat's sort of out of the barn, if you will. And it's much harder to treat than when patients come to us on an annual basis after they've been diagnosed with diabetes, where we can catch the earliest signs of diabetic retinopathy and recommend treatment earlier.
Wow. It sure is a dreaded disease. We have about 2 minutes left, so I'd like to kind of end up on something that's pretty common. I hear about a lot, dry eye. Okay, what is the dry eye syndrome and why do people get that?
So dry eye syndrome is something that is probably the most common disease that we see in ophthalmology, that and blepharitis. Blepharitis is swelling of the eyelids and oil deposits that can sort of get clogged up in the pores of the eyelids. When the eye gets dry, it inhibits clear vision. Patients will say, I blink and I have to keep blinking to see better. They see fluctuating vision, better vision in the morning, worse in the afternoon. And part of this is also linked to what you call the computer vision syndrome, of when patients are staring at a computer screen or staring at a book, they forget to blink. We're not drinking as much water anymore. We're drinking a lot more caffeinated and carbonated beverages, and these work as diuretics. So they dry your body out and make you urinate more, but they also dry out your eyes. As we get older, hormones change. We have environmental factors like the heat in the car blowing right out your eyes. It's a very complex disease with a lot of different issues related to it. Fortunately, it is something that's easier to treat, but it requires a lot of treatment in terms of drops and warm compresses and so forth.
Yeah. What causes people to flick their eyes a lot? I mean, I've actually seen somebody who's on television a lot do that, where they're constantly flicking their eyelids.
Yeah.
What causes that? Is it a particular kind of a disease?
It is, and it's actually related to what we just talked about of dry eyes. Blepharospasm is flickering of the eyelids,
Okay.
and the most common reason that patients have both eyes of flickering eyelids is because of dryness.
Okay.
When the eyes have dried out, and many people on television are staring or reading a teleprompter, have big bright lights being shined at their eyes, they're more susceptible to having something like that happen. And we can use things like Botox to treat this sort of a problem, and it can be very gratifying to the patient.
How about that? Interesting. Okay, we're going to have to kind of sign off right now. How about giving the phone number of More Eye Institute if anybody really could use your services?
Sure. So our phone number is pretty easy. Here at Phoenixville Hospital, it's 610-422-5000 is the best phone number to call to schedule an appointment.
Great. Well, it's been fascinating, Doctor, talking with you. I learned a lot.
Thank you.
And you covered a lot of territory in 30
Thank you.
minutes. So thanks very much.
Thank you very
Appreciate
much
it.
for having us.
Sure. And thank you for tuning in. It's been our pleasure to bring you this show, very interesting show, an important show on eye care with Dr. Ravi Patel from the More Eye Institute here at the Phoenixville Hospital. I'd like to thank our TV team who put the show on the air for us today. Our show was directed by Mike Miller, and we received technical assistance from Ben Warner. Our sponsor actually has been 4 sponsors: the Phoenixville Hospital, the Phoenixville Community Health Foundation, the Phoenixville Healthcare Access Foundation, and the Activate Phoenixville Area Community Wellness Program. I'm Lou Beccaria. It's really been a pleasure to be with you folks. And remember, if you're healthy, you're wealthy. I'll see you next time.